Effort is expected to ultimately address Nigeria's healthcare workforce shortage, providing much-needed relief to the country's medical sector. Joining us in the studio for this conversation is social development advocate Olutobosun Oshifowora. Good morning. Thank you for joining us.
It's a pleasure to be here.
And we'll have our other guests join us later on. But Bosun, let's begin with how we got to this point in the first place. Because at some point in this country, we had people from outside the country coming here for treatment. And then all of a sudden, we are seeing our own people rush out in droves to these other countries who are seeking their expertise. How did we miss it? What went wrong, really?
There's something they call the push and pull factor.
Right.
The push factor is what pushes people out of a system, and then what pulls them into another system. Over time, I think in literally all facets, we just dropped the ball. And what we had, or what we have, or never became unattractive to people. And then simultaneously, outside became more attractive. You have a situation where you work in a hospital setting, growth with respect to research and development wasn't available to you because you find that you go abroad, the same person who was literally stifled, who had nothing doing, medical doctor who spent years, you know, he goes abroad and then he just blows. Let me use the normal, yeah, you know, see the normal street parlance, you know, he blows because you're in a place where you're working with everything is at your beck and call, and then you have all the equipment, you have all the necessary things here. Meanwhile, in this place, you know, you're literally redundant, despite what you have in your head. If you don't have the best of equipment, you don't have any ability to research and develop yourself or develop what you're doing, then you're literally not going to find anything. It won't be attractive. So, and I said simultaneously outside became more attractive. That's why you find that people started living in droves. This thing started in the mid-80s, and then by the 2000s, it just skyrocketed and everybody started. Then also the earning power was a major factor, because you look at what you're earning here and then you look at what you can earn outside. It's just foolhardy to stay there. Everybody will gravitate towards, you know, something good. Yeah. That's one of, despite the fact that the profession it's not the profit-oriented thing. The orientation they had is not about profit. It's about humanity.
Service
but over
humanity,
time, yes. But over time, you find that you're human as well, and you need some sustenance. You know, so before you die, before your time, so there's need for you to go out. You know, so over time, I think the administrators generally we drop the ball in all facets, and so that's one of the reasons for the brain drain. People had to leave. People had to look for green pastures. People had to look for an enabling environment where they could thrive. And I'll give you a personal example. Something happened about 10 years ago. That was when I knew that there was trouble in our medical system. My mother-in-law sent her driver somewhere. It was around Easter, about 10, 11 years ago. And he had an accident around Oregon Road. And they took him to the accident and emergency unit by the toll gate, the former toll gate, by adjacent Magodo. So coincidentally, that day, around that period, there was strike and loot. So everybody was in lawsuit. Everybody was rushing down to lawsuit. In fact, if not for what happened, I wouldn't have known, you know, that kind of situation. So there were a lot of people. We too were trying to get a bed for him. The place was filled up. So I saw two things. Two things happened that day. One, there were just two doctors at the emergency unit. This was 11 years ago, last week. It's a different ball game now, but it's a personal experience, so I'll never forget it. So we were trying our best to make sure that we get him to the emergency unit from that point. So they said there must be bed. So there was no bed available. And because of the problem with loot, there was a lot of, you know, casualties coming into last week that day. It was crazy. It was as if hell was open. I just saw all kinds of accident victims coming. Now, so I saw 2 doctors. One was in the inner room attending to more serious one. Then there was a lady doctor who was literally going around like this for hours, attending to people. I was there from 10 till about 7 in the evening. So I was like, this woman will collapse. That's one side. The second side was we pulled all the strengths, we called all the people we knew to be able to get him a bed there. When he was 7, they said, I'll say it in English, but they said a thing in Yoruba that, you guys are lucky, bringing him, someone has died.
Oh my goodness.
Oh boy.
I kid you not. It was a personal experience. Initially, we were happy. So when we were going, I was reviewing that. It took someone to die to get him a bed. That this is not. So anybody working in that kind of environment, for the lady doctor, I can't remember her name. I didn't even look for her name. I was just like, I can't work like this. I will pass out under 2 hours.
Yeah.
And she had to attend to people. So tell me, if you work in that kind of environment and you see something else outside, I don't even know the remuneration. I don't think it would be as much as getting something outside. So working in that kind of condition, you can, brain drain is inevitable.
You know, the remuneration, you don't need to know the figures. You don't need to know the figures.
It's predictable.
I have a doctor friend in the United States, and he earns up to $15,000 a month, $15,000 to $16,000. Let's convert that. We're talking about 23 million or so a month. Side by side, the Nigerian doctor that goes to work and faces something like this, like
in the world.
And so on. So we want to understand why the brain drain is going on. But the government has started some stuff that should improve the health sector, like the National Health Sector Renewal Investment Initiative. Is it something good coming too late?
The biggest room in the world is a room for improvement. That's my own saying. It's better late than never. Because if you look at, I mean, this is the first effort in the right direction, because all of us come here and we lament brain drain, brain drain, brain drain, and nothing is being done. Fine, this is like a 5-year program that will still continue, but I mean, this is the first time the government is addressing the issue. Because I can assure you, those who have gone will not come back. I mean, what are you coming back?
Well, there are
maybe to build a hospital.
To carry out, perhaps consult and do other things in the country.
But that has not reduced that has not taken away the fact that the number has been largely decimated. Now, so the best thing to do, let's say if you find yourself in a hole, the first thing is to stop digging. So what the government has done to stem the situation is to, okay, fine, those who have gone have gone. What can we do to bring in new set of people? What can we do to train new set of people? So that's one of the reasons for this initiative, because then you now look at what you have. Are the facilities adequate? No. Are students even attracted to studying? No. So these are the things you have to do, and this is a fantastic initiative. And then you know that the reason is Dr. Tunji is a surgeon, trained in the United States. He started here, then, you know, he had a healthy practice in the United States. So that's why when you have the right people in the right places, these are the kind of things you start seeing. Because he could identify the problem and he went straight for it. Now, and I think this also should be replicated in literally every facet, because we have brain drain in every segment. And so the first thing government needs to do is, okay, fine, if we can't bring back those who are gone, not as consultants now, but to come and work properly, then let's start training new set of people. That's what they've done with this. There's a whole lot to do as well, because you don't want to train this new set
let me tell you where I was going to. I want to talk about welfare and also, you know, this initiative, because we've also seen the initiatives have come out and they have gone down the drill. But we're happy that this government, they're very particular about healthcare. Now, my problem is you train new people and the welfare is not good. These people, we are going to go through the same circle. So how is this initiative different?
Well, it's a step in the right direction. I'm not going to play down this. It's because we're not going to borrow doctors. Exactly. Or even if you want to borrow, they won't give you.
They won't give you.
And then you borrow at a higher cost.
Yes.
Now, so the best thing, that's why I said it's an effort to stem the problem. Now, so the first thing is, okay, let's see, what can we do to make this thing attractive? Our facilities are bad. So I know the same people who came up with this, we definitely have to look into the welfare package. Because if you don't take care of welfare, you are just training people.
But don't you think the welfare is more important?
Yes, there are initiatives being done, but you see, it's a bit complicated. It's more complicated than what you can see, because there's a labor angle, then also there's the issue of availability of resources. Right. Sometimes, you know, they say the spirit is willing, but the body is weak. If you don't have the resources to give to the people, then, so I feel everything is not about money. There are welfare packages that can be put in place. There are things that can be done to make sure that, okay, people don't fall into that trap, or people don't get easily attracted to going abroad. For all you care, it's not everybody who wants to live abroad. I love it here.
Yeah.
But if you look at the conversion, and then if you look at the demands, the financial demands on you, you know, those are the things that make people. Then also some of the things, one of the reasons people go abroad is because of their kids. They just feel, okay, education is better there. Some things, you look at all the indices, security, and then security. So when governments start looking at all those things, and then they start putting them in place, I assure you, even those who are gone may come back. Because for me, a major turn-off abroad is the weather. So, I mean, you're going, and the next thing, weather changes, and then you're freezing and all that. I love it here. I love everything here. But at the same time, if you look at your finances, that's a major reason why a lot of people are abroad. Now, so these are the things that the government needs to look into. But this one, fantastic initiative. Then the next thing is for the welfare, so that we don't create a system where we're just training people and then they're shipping them abroad. So welfare, security, a lot of things. But I know they're trying, and they're going to come up with something, because those who could do this definitely know what it is. And like I said, if you have people who understand the system and the business, it's just a matter of time before they get it right.
But really, if we look at this matter, because of the level of decay in terms of infrastructure and the dearth of the gap of workers that we need, the expertise and all of it, can the government handle it alone? That's the big question. We are not seeing as much investment in this sector. Talk about private sector coming in. You see the subnationals are seemingly not even doing anything about it. Primary healthcare is something you shouldn't even bother speaking about. And you wonder, really, are we being sincere? We've seen NAD go on strike several times. They've engaged government talking about this matter of welfare. What else can the government say to these people? Because trust is very important.
See, the most important thing here is the personnel handling these issues. If you take me, I'm a lawyer. I'm trained to be a lawyer. I try to read, I try to know what's going on in other places, but if you put me in NASA or a space facility, I'm going to fumble. But if you find my opinion on law, legal matters, legal administration, I run a law firm. I know what is wrong with lawyers. I know their complaints. I listen to them. Now, so what I'm trying to say is that one of the things that can help what you put forward is to start getting the right personnel in the right places. We just talked about Dr. Tunji Alausa now. He's a Minister of Education, but he has a bias for medicine. That's why he has taken this initiative. So the moment we start having the right people in the right places, things like this will come up. And what you need, you just need 4 or 5 persons, and then it will go viral.
So I would say over time we've not done that. We've not had the right people in the right places.
She just talked about primary. You find people who don't have businesses in some places. Sometimes we cannot play down the fact that nepotism is almost the order of the day. We find a lot of people, the governors who don't have business, the people who are governors today, who can handle wards or local government. But you have to wait for their time to expire. That's the sad part of the kind of democracy we practice. But literally what I'm saying, or basically what I'm saying is, we should start by having the right people at the helm of affairs. Because we've seen, you remember the days of Dora Akunyili.
Absolutely.
It took just one Dora
person
to turn around. You know, so, and you know, people always talk about institutions, we need to, you need individuals first who can actually put in place the right institutions for you. Because you can't start with institutions, you start with individuals. You start with people who have sincerity of purpose. You start with people who have the nation at heart. People who have humanity at heart. That's what you need. If you don't have those kind of people, then we're just going to be
But can the federal government handle this alone?
Now, so I'm coming to that.
Yeah.
Now, when you have those kind of people, they know the right persons to call. Because, one, the federal government, let me answer you straight up. The federal government cannot handle this alone. You need private participation. The private sector is always willing. But you raise something, the issue of trust. You raise, I mean, another thing following on the issue of trust is everything falls and rises on trust. Because if I know you and I'm confident in what you do, it does. I will join you, even if you don't call me. Because I know, you're the one there, I trust her, she will do it right. And then I'll call other people. Before you know it, people will come. But if I know that this person is just trying to rig money for himself, even if you come and pull me, I will just follow you, and then when you turn, I turn. That's basically what it is. So, but the government cannot handle this alone. They need support from the private sector. They need support from the people as well. Now, and it's very possible. The people are always willing. They just need the trust element that they need. And for all you care, you see a massive change.
Let us look at how politics plays in this thing we're discussing. There's this gentleman that came to my state and wanted to build a massive hospital. Should I call it a hospice? Because the whole idea of that hospital is that people will be charged less than what regular hospitals would ordinarily charge. That's something anybody will expect that the state government will jump on. But the state government gave conditions. All right. Now, let us also talk about these square pegs in square holes that you talked about. They bring their CVs. The politicians see them, but they have other considerations. How can this be done away with? And then we now start looking at things holistically and thinking about the people in appointments and so on.
I'm not going to say it's impossible. But the kind of structure that we have, it's unfortunate. I
hear our second guest. Unfortunately, we need to quickly cut your line of thought. Our second guest, Dr. Nsé Abasi Ekanem, who is a public health expert and national coordinator, Civil Society Network on Hepatitis, just joined us. Good morning. Thank you for joining us. We've been speaking about this development by the federal government, talking about bringing in 18 billion naira to address the wrath, if we might want to put that, in the medical sector, to also encourage students to be a part of it. 18 billion for 18 institutions that are teaching issues bordering on medicine and all of it. What do you make of this step being taken by the government?
Thank you very much, first of all, for having me. Brain drain is something that is quite worrisome. And so any effort taken by the government towards curbing the menace of brain drain is something that is quite laudable. And I must say that when I read the news, I mean, I could relate because Dr. Tunja Lausa is one person that those of us in the healthcare system in Nigeria really love a lot. And so this effort is something that is highly in demand right now. Given the fact that we are losing doctors in droves, and not just doctors, healthcare professionals in entirety. I mean, every year you see thousands of healthcare professionals, write to the council to get letter of good standing, of course, which is the letter that we as healthcare professionals get from the council so that we can move over to other places to work or to study. And so when you look at that and vis-a-vis the number of students or number of graduates that are churned out every year, you begin to see that it presents a very dire situation. So this investment by the government, to burgeon medical education is something that is quite heartwarming. And we are hoping that over the next 5 years, we'll begin to see 5 or to 10 years, because of course it takes an average of 6, in some cases 7 years for medical students to graduate from universities. That would also help to bridge that gap. But I think beyond that, we should also probably look at how we can retain those graduates when they are done from school, because that is one thing that is very important. Sometimes you have people who are even in their within the school system, while they're in medical school, they're already telling you, oh, I'm waiting to get my license so that I can japa, permit me to use that word. So when that is the situation, it presents a very serious situation. That means that that student who have been trained by the government, because it takes over 50,000, sometimes up to $200,000 to train a medical student in Nigeria. When you look at the investment by the government, it takes a lot. And then you have that student saying, oh, when I'm done. In fact, some of them will start thinking of how to write, PLAB for UK or USMLE for US and other countries. It presents a dire situation. So I feel that beyond just investing in medical education, which is a very laudable effort, thanks to the government, and we need to also look at what are those push factors, those factors that are pushing our graduate out of Nigeria. I know we cannot address all of them. No government, even in US, can address all of them. But can we limit them? Things like job satisfaction, things like, even for me, remuneration comes last. But jobs, because for every medical doctor, whether you're a medical doctor, whether you're a pharmacist or any healthcare professional, is not drawn to the profession because of money. Because if it's about money, people in petrochemical engineering, they make a lot of money compared to medical. So it's about that service to humanity, that resolve to save life, that passion to save life. But we need to have the right tool, the right environment to work. When we don't have this, naturally we'll look for where we can get it. I'm telling you this as a healthcare professional, So the government need to also look at that aspect too. Yes, we churn out doctors, we invest in education, churn out these doctors, but we need to keep them. Because if you invest in education and then get them out, and they already have the mindset that when I'm done, I'll leave, then, it's more like an exercise in futility. So while we invest in education, which is very laudable, let us also look at some of those push factors. Let's make sure that we have security because most of the medical professionals that are leaving the country, I've interacted with a number of them. They say, oh, Nigeria is, the security is a challenge. We know that it's everywhere in the world, but let's see how we can reduce it so that they can be confident in working in Nigeria. Let's look at their spouse, employment, let's look at education for their children, because these are really the factors that push them out. So if we address these push factors and at least reduce them to the barest minimum, then we can have them work in Nigeria despite the amount that is offered outside. They will be willing to work, because for a healthcare professional, it's not about the money, it's about service to humanity.
Yeah, service to humanity is what everybody would want to look at when you're talking about health delivery. Would you say that the initiatives that government have already started now is a step in the right direction? That is one part of the question. And the second part is, how would you have handled it in a situation like this, where we are having so many of our doctors leaving Nigeria and the situation at home is not improving? If you were given the opportunity to solve this problem, how would you handle it?
But I think it was about, correct me again. Okay, let me address the second question. For me, in this situation, what I would do is to, yes, first of all, I'll look at, looking at those who are around. There are some doctors, I must tell you, I know this very well. There are doctors who are in the country, but they are not being hired. They are just there roaming around the street. They don't have gainful employment. Can we lift the ban on employment? Let's have more doctors brought into the public sector. Because if you go to some hospital, some public hospital, you see that some doctors who were previously working there have left and they have not been replaced. So let us look around us first of all. Are there doctors who have graduated but have not been employed yet? Can we bring them into the system? Because one of the things...
Yeah, unfortunately, our time is up. Unfortunately. We need to, but your point has been made. 100 billion being put in place by government is a lot, and you have said it's a step in the right direction. Thank you, public health expert and national coordinator, Civil Society Network on Hepatitis, Dr. Nse Abasi Ekanem, for your time. We must also thank you, social development advocate Olutubosun Oshifora, for your contribution as well. Though not a doctor, but you went ahead to talk to us about it. Thank you so much. And happy Workers' Day to you guys.
Happy Workers' Day.
Thank you. Thank you. All right, we'll take a break now.